Greetings, everyone. My name is Carolina, and today I will be talking about the topic of professional image. So, before I dive into this discussion, I want you to ask yourself, when was the last time that you took a good look at your professional image? Whether you're a new nurse or one with years of experience, how important do you think having professional image is when it comes to effectively performing your role as a nurse? So, now to raise your interest, I want you to visualize yourself as being a patient laying on a hospital bed, afraid of the unknown. And then suddenly, someone rushes into your room with a flip badge, oversized and wrinkled scrubs, a serious face, and a handful of medications. And without a proper introduction, just lays those medications over your table. And even without making any eye contact, just tells you, I've got your meds. As someone who's already anxious about the situation, being the patient, this might prevent me from trusting this stranger. So, this is a perfect scenario of a nurse who is in a possible need of a professional image makeover. According to an article published in the Nursing Journal written by Pullen and Ali, your image includes how you look, how you carry and present yourself, how you think and act, and how you communicate to others. So, to expand on this, there are 3 points that I would like to include, with the first being that of image and credibility, and how both of these are associated. Image is everything, especially for us nurses. Every day we're working with different individuals from different backgrounds, ages, education level, and our image is affected by how we present ourselves to these individuals. Our appearance, our work ethic, and communication skills. All of these traits affect our credibility. And if we have credibility, we have the trust of those who depend on us, whether they are patients, other nurses, or leaders. Second, I want you to never underestimate the value of first impressions. You only have a fraction of a minute to create a positive impression on others. First impressions can open or close doors, and in the same way, they can help you in creating opportunities for you to be able to establish positive, trusting relationships with patients or even other members of the clinical team. Acting and behaving in a way that conforms with the norms of the profession is essential to thrive as a nurse. Portraying positive characteristics such as caring, compassion, intelligence, diligence is important to create trust, which are qualities that you probably already have because otherwise you wouldn't have chosen this profession to begin with. Also, dress so that you present an image of confidence and respect for yourself and others. Workplaces have standards of professional attire for a reason. In our cases, as nurses wearing scrubs, show up to work like you're ready to take on the day with a fresh, clean, and wrinkle-free scrubs, well-groomed, clean nails, and limit accessories such as necklaces that could even be a safety hazard for yourself or for your patients. Lastly, I want you to acknowledge the power that effective communication has on nurturing a professional image. Communicate in such a way that you accurately relay the message that you are intending to convey. Say what you mean and mean what you say. Be kind to others, greet them, and acknowledge their presence. Watch your tone and allow others enough time to communicate their needs to you, especially when that ability can be affected by a disease process or by being in a different environment. Remember that smiling is so powerful and can say much more than you can transmit with words. Be cautious of nonverbal cues of communication. If you are a new nurse, make sure that you show confidence in what you're doing, even if you're doing it for the first time. If you are an experienced nurse, make sure that you encourage others with constructive feedback rather than negative facial expressions. So don't be that nurse mentioned earlier and do your part on assessing yourself and identifying areas for improvement. As a professional, you not only owe it to others, with the most important receivers being your patients, but you owe it to yourself. So show the best positive image that you can as a nurse. Thank you.